Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. There has been a lot of emphasis on the ability for veterans to seek care in the community and following the prescribed law. Here's what we're talking about. What's going on here is the VA Secretary, Doug Collins, is talking about the Mission Act and the law put into place to allow veterans to seek care out in the community. There has, over the last several years, been a little bit of a pullback on the ability for veterans to receive care out in the community. And from my understanding and from, the outside looking in, it was a way to really redirect veterans back into the VA and really look at the VA as the number one thing, right? We need to preserve the VA. Preserve the VA, make, customers. You need people coming in the doors instead of going outside of the VA. Well, honestly, I didn't like that approach, and I had done videos on that in the past. The reality is that veterans and their healthcare should be the number one priority, whether it's internal or external. I get it. Look, it's a hard rope to walk when you're trying to balance care and services and maintain operations, right? If you have nobody walking through the doors, there's no need for you to be there. I get that. It's a hard balance. At the end of the day, veterans need to come number one. And in the Mission Act, it's spelled out how and why you would be able to obtain community care. And the VA actually put it on their website, different situations in which you could receive community care. Now, I'm going to dive into this a little bit, share it with you. Before I do, though, I want to throw out a special thank you to David Campbell, 9311. David Campbell, thank you so much for the super comment, super chat. I truly appreciate your support so very much. Thank you again, David Campbell, 9311. All right, so with that, let's jump into it. I'm going to go through the eligibility for community care outside of the VA. There's more than one way you can do that, and it's important to understand how and why you could receive care outside of the VA. With that, hit the thumbs up, subscribe, share with a friend, all that good stuff. I truly appreciate it. Every thumbs up, every minute watched really does help to share the information. Those are the two asks. Hit the thumbs up, let the video run. That will push this information into the hands of those out there who need it. And together, many hands make light work, so I appreciate your support. All right. Eligibility for community care outside the VA. As a veteran, you may be eligible to get care outside the VA. This means we, the VA, will pay the cost for your care from a healthcare provider in our community care network. What does that mean? That means you can't just go to any doctor, first of all, out in your community. They have to be part of the community care network. Now, the exception to that would be is if you went to an emergency room for an emergency situation, right? That's automatically covered. But you still must inform the VA within 72 hours, ideally, if you have the capability of doing so, that you did seek care at an emergency care facility. All right, moving on. You can still always choose to get your care at a VA health facility. So you always will have that option, right? So eligibility requirements. To be eligible for community care, you must meet the requirements listed here. First one is 2 bullet points, and it says you must meet both of these. You are enrolled in or eligible for VA healthcare. I would say if you are eligible for VA healthcare, just go get enrolled. Get that off your plate. It's super easy to do. Just go into a VA healthcare facility. They have a little office there with folks working in there that can help you do that. Next is you have approval. You must have approval. You have approval from your VA healthcare team before you get care from a community partner or provider, except for certain cases like urgent or emergency care, which we talked about a minute ago, right? I mean, that's kind of goes without saying, but just so you're aware. Anything other than an emergency type of a situation, you would want to get prior approval from your VA healthcare team. All right, so next, it says, and you must meet at least one of these requirements. And there are several bullet points, 7 of them to be exact, and we're going to go through each one. And then we're going to also give examples of what each one of these would look like in the real world, we'll say. All right, so number 1, you need a service that the VA doesn't provide at any VA healthcare facility. Or Now remember, the ors are separating the 7 different bullet points. You just need to meet one of these. You live in a state or territory that doesn't have a full-service VA health facility. Or you live in Alaska, Montana, North Dakota, South Dakota, or Wyoming. Or you qualified under the 40-mile distance requirement on June 6th, 2018, and live in a location that would still make you eligible under these requirements. Or the VA can't provide you the care you need within our standard for drive and wait times, which we'll get into in a minute, because this is oftentimes the most common access to community care. All right, number 6 here. You and your VA provider agree that getting care from an in-network community provider is in your best medical interest. And the last one here, the VA can't provide the service you need in a way that meets our quality standards. All right, so let's do some examples here so you're aware of what this kind of looks like. So let's jump into it. Example 1, a service we don't provide. You need dialysis, but we don't provide dialysis at any of our facilities. So you're eligible to get dialysis from an in-network community provider. Example 2, no full-service VA health facility. Okay, no full-service VA health facility. So if you live in Alaska, Hawaii, New Hampshire, Guam, American Samoa, the Northern Mariana Islands, or the U.S. Virgin Islands, we don't have full-service VA health facility in your state or territory. So you're eligible to get care from an in-network community provider. Next one is qualifications under the 40-mile distance requirement. You live in Alaska, Montana, North Dakota, South Dakota, or Wyoming, and you previously qualified under the Veterans Choice Program 40-mile distance requirement on June 6th, 2018. So you're eligible to get care from an in-network community provider. Next one here is drive and wait time standards. This is the one that most folks would qualify or typically will qualify for. It's just the kind of the overall catch-all, right? And this is what a lot of people are looking at. So anyway, for primary care, there's two. They break it into 2 different subsections: primary care or mental health, and then they also have specialty care. So for primary care or mental health, you need a primary care or mental health appointment. But the VA cannot schedule an appointment for you at a VA facility that's within 30-minute average drive. Not miles, minutes. Remember that if you're in the middle of LA or New York or something, or Washington, D.C., going 10 miles might take you an hour. All right. So it says here that if the VA can't schedule you an appointment for your VA at a VA health facility that's within a 30-minute average drive from your home, or we can't schedule an appointment for you within the next 20 days, in each of these cases, you're eligible to get primary or mental health care from an in-network community provider. So again, 30-minute drive time, minutes, 30-minute drive time, or within the next 20 days. That's less than 3 weeks. 3 weeks would be 21, so 20 days, less than 3 weeks. So if they cannot provide that for you, you should have that ability to seek community care. So the example would be, hey, Mr. or Mrs. Veteran, we got an appointment scheduled for you, and it's 4 weeks from now. All right, well, that's 28 days. You should be able to say, you know what, that's not going to work for me. I really need to be seen sooner. Can I get community care? That should be how that works. Or, hey, we got an appointment for you. It's scheduled on this day at this facility. And you go, wow, that's going to take me an hour and a half to get there. That's outside of the 30-minute average drive time. You know, I'd like to do something a little closer to home. Could I go ahead and do community care? That should be how that works. All right, next one is for specialty care. You need an appointment for specialty care, such as cardiology care for a heart problem, but the VA can't schedule an appointment for you at a VA health facility that's within 60-minute average drive from your home, or they can't schedule the appointment for 28 days. In each of these cases, you're eligible to get specialty care from an in-network community provider. So again, they've just pushed out those same parameters, right? So instead of a 30-minute drive time, they're saying 60-minute for specialty care. And instead of 20 days, they're saying 28 days would be the time frame. So the same example works, right? You're a veteran. They say, hey, we get you an appointment. It's 40 days from now. You can decline that. You should be able to and say, hey, look, I'd like to go to the community care route for that, or it's going to take you 2.5 hours to get to that facility that offers that. Well, that's going to be too long, and you should be able to request community care. If for some reason, and this is super important right now, if you are a veteran who is in that situation, right, any one of these examples, and you feel as though community care is the right option for you, and you are being dissuaded from it, and you're not able to get that ball rolling, and you clearly meet the criteria, reach out to your congressional member's office and let them know that you are disturbed by the inability to access community care when you clearly meet the requirements. I mean, this is directly from the VA's website, from the Mission Act stuff. So, all right, next one here, your best medical interest. If you have a certain health condition that your VA provider doesn't have experience treating, but you live near an in-network community provider who specializes in the condition, if you and your VA provider agree that it's in your best medical interest to get care from the community provider, you're eligible for community care for this condition. So if you live in an area that has some renowned facility that focuses on that specific condition, you might want to bring that up to your community provider or to your VA provider and see if you and them can agree to have you get community care at that specific provider if they are in network. All right, I say in network if they are an authorized community provider. All right. Next one, last one here is quality standards. You need cardiology care for a heart problem, but the VA determined that your local VA health facility doesn't provide cardiology care that meets their quality standards. You may be able to get cardiology care from an in-network community provider. All right, with that is community care and the different ways in which you can access it. Again, if you get pushback, and you clearly meet the criteria and you're getting the runaround, reach out to your congressional office. Let them know. I mean, this is a hot topic right now, and it would be important to share your story. Thanks so much for watching. I appreciate each and every one of you. Have a great one. And remember, if we don't take care of each other, something went wrong.